is on the screen for you now.
Well, next tonight, a mum from Cheshire who stopped smoking when she became pregnant with her first child is urging others to quit the habits for good.
Yeah, Mia Rogerson from Middlewich was a heavy smoker until she learnt she was expecting her daughter. She got support from the NHS and says understanding how the habit would affect her baby was a huge wake-up call.
Well, the NHS says complications in pregnancy in mums who do quit are reduced and babies are less likely to be born too early or underweight.
Mia's been speaking to our reporter Zoe Muldoon.
1.5-year-old Remy Jean is growing up fit and healthy, thanks, in part, to her mum stopping smoking when she became pregnant. Mia used to smoke 15 cigarettes a day, but after finding out she was expecting, she knew she had to quit for good.
I was quite a heavy smoker, to be fair. Like, I'd just have like 5 the first hour I woke up. But I was actually diagnosed infertile before falling pregnant with Remy, so already I was like, OK, I need to try everything in my power to go full term and stuff.
Mia got support from her local NHS Stop Smoking service. She was given a nicotine inhalator to manage cravings, but the biggest wake-up call was learning about the risks to her baby.
She explained, like, every inhale you take of a cigarette, this is how the oxygen has stopped reaching your baby. And from that moment, it was like, I was just a bit taken back by it. Like, I'm depriving my unborn child here of oxygen, like she doesn't have a choice. Everything I put in my body is going to affect her and she needs the best. I think that really did put things into perspective for me as well and gave me that motivation, like, actually, no, I can't continue.
It's all worth it, isn't it? The stress of trying to quit, but it's worth it in the end. You've got a gorgeous, healthy little girl.
Yeah, 100%. Seeing the outcome of having a perfect, healthy baby, you feel a lot healthier as well.
NHS data in Cheshire and Merseyside shows the rates of women smoking up to giving birth to their babies has fallen to 4.8%, down from 6.5% the previous year. Almost 2 years after quitting, Mia remains smoke-free and is expecting another baby girl in the autumn.
What advice would you give to other mums who are smoking but really want to quit?
I would say definitely reach out. I think a lot of women don't know where to get the support from, but 100% just speak to your midwife about it, speak to your local GP about it, because they can refer you to the right person for you.
Since stopping smoking, Mia feels healthier, has saved money and is building the best possible life for her family. Zoe Muldoon, ITV News, Middlewich.
Well, many congratulations to Mia and the rest of the family ahead of the arrival of baby number 2. Well, a little earlier we were joined in the studio by Ceriann, who works for Cheshire and Merseyside NHS, and began by asking her why smoking is still an issue among those who are pregnant.
So we know that smoking is an addiction and it's really, really hard to give up. So for some people, they need additional support. So we will support them without being stigmatised or judged, but actually we really need to focus on letting them know that support and help is available to help them quit while they're pregnant.
And I mean, it must be very, very difficult for some people. I'm sure they want to stop when they find themselves pregnant, but as you say, it's an addiction. It's really difficult, isn't it?
It is really difficult, but we do know that if a pregnant woman accesses our services within our maternity services, we know that they're 3 times more likely to successfully quit. So it's really, really important that we have conversations with women about smoking and we reassure them and let them know that support is available and they can successfully quit and have a smoke-free pregnancy.
What would your main message be to somebody who is pregnant but also is a smoker and they find it really hard, if not impossible, to stop smoking?
So I would say that the most important thing that they could do for both their health and the health of their baby is to quit smoking. So I would suggest that they either have a conversation with their midwife or another health professional, and they can outline all of the support that's available to them. We will be committed and we won't judge them, and we will continue to support them. There is behavioural support combined with medication that's available, so nicotine replacement therapy. So there is lots of support out there. And we will continue to support them throughout their pregnancy, which is really, really important. So if they are struggling, they will have somebody to talk to and they will be reassured that they can successfully quit.
And there's evidence that this is working, isn't it? Because the numbers are falling year on year, aren't they?
Yeah, they are. So we've seen some amazing outcomes in the past 12 months. So we've seen our rates fall from 9.5% to 4.3% of smoking at time of delivery. So that's over 4,000 smoke-free babies that we've seen across Cheshire and Merseyside, which just means so much in terms of reducing risks around health.
And I guess the bottom line to all of this is that you're not alone. I mean, pregnancy is quite a daunting time, especially if you're going to become a mum for the first time. The support is available, it is out there, and that's where people like you come in.
Definitely. So in NHS Cheshire and Merseyside, we've invested in services across every one of our maternity services in Cheshire and Merseyside. So they're called treating tobacco dependency services. So if you just talk to your midwife, she'll know what you're talking about, and she'll be able to give you all of the information and advice and get you in really, really quickly so you can quit as early as possible in your pregnancy and then have a smoke-free delivery and take your baby home to a smoke-free house.
Well, Ceriann, lots of good advice in there for people watching at home. Thank you so much for coming to chat.